maybe trying to book a simple appointment, or you're stuck on hold forever, or just trying to figure out a bill or something. It's a pretty common frustration, I think. And for the healthcare organizations themselves, well, every single patient interaction is critical. Get it right, great. Get it wrong. It costs them not just potentially losing that patient, but actual revenue too. So today we're going to take a real deep dive into how artificial intelligence, AI, is fundamentally transforming patient engagement and operational efficiency in healthcare. We're really talking about moving away from that sort of subjective guesswork, hoping for the best, into a much more precise data-driven science. And to really see how this works, we're focusing on a platform called Patient Prism, drawing on some recent insights and analyses.
That's exactly right. Our mission here really is to show you the tangible ways AI can pull clear, measurable outcomes out of what used to be these, well, frankly, fuzzy conversations happening every day. And this impacts everything, from how providers market their services, right down to how they recover revenue they might have otherwise lost. For you listening, this deep dive is kind of a shortcut to understanding a really critical trend that's shaping healthcare right now, heading into 2025.
Absolutely. And we're hoping to uncover some maybe surprising facts, some aha moments, showing how AI is actually used in ways you might not expect, like finding out why some patients book right away and others just seem to vanish, and how AI can, fix that. Okay, let's unpack this. So let's start with that basic challenge we mentioned. Healthcare organizations, they're under huge pressure to optimize every single patient touch point. How do we actually move past the guesswork?
Yeah, the guesswork problem. A key piece here is Patient Prism's core tech. It's an AI platform, and it uses natural language processing, NLP, which lets the AI understand the meaning behind human words, and also neural networks, which are these complex algorithms that learn from tons of data. And it uses these to meticulously analyze phone calls, the ones between patients and providers.
So it's more than just recording the call.
Oh, much more. This isn't just about playback. It's about extracting deep, actionable insights, things that were honestly impossible to systematically track before, especially at scale. This tech can answer questions like, was this caller actually a high-quality lead for the service they netted? Or did the agent follow the best practices we've set out? And crucially, was the patient actually offered a suitable appointment, or did they just kind of fall through the cracks, leaving money on the table?
Falling through the cracks. Yeah, that happens a lot.
It does. And by analyzing these specific data points, providers can do way more than just measure stuff. They can actively recover lost revenue. They can seriously improve their conversion rates, inquiry to booking. And they get this profound understanding of patient behavior. It enhances the patient experience overall, maximizes that patient's lifetime value. It genuinely shifts patient engagement from like an art form based on gut feeling to a precise data-driven science.
That's a huge shift.
Yeah.
Moving from just reacting to being proactive, using data. Okay, but how does this actually play out? Let's follow the patient journey, maybe starting right from how they first find care. This is where it gets really interesting, I think.
Definitely. If we connect this to the bigger picture, we're talking marketing attribution. In healthcare, it's not just about getting loads of leads, right? It's about lead quality.
Quality over quantity.
Exactly. Patient Prism tracks that whole patient journey from the very first click on an ad, maybe on Google or Facebook, right through to that critical first phone call. It gives them real-time data on exactly which marketing channels, which campaigns are driving the high-value patients, the ones ready to book. And then this is the clever part. That data gets fed back into platforms like Google, Meta, Bing, so their own AI can refine targeting.
So it closes the loop.
Precisely. The outcome for you, as someone looking for care, is just smarter marketing. Providers lower their acquisition costs, get better ROI, which means more efficient outreach to patients like you who actually need their services. Fewer irrelevant ads, ideally.
Okay, so AI helps reel in the right patients, but then they call. And that first call, that's where so much can go wrong, right? Even the best marketing fails if the call experience is bad.
Absolutely. And this is exactly where sales enablement and call center performance analysis comes in. Patient Prism uses this proprietary 14-point rubric to evaluate calls. It's not just a generic checklist. It looks at soft skills, enthusiasm, empathy, active listening, but also things like, was the communication clear? Did the agent offer a good next step? And it uses a voice fingerprinting to track individual agents, so managers see exactly who excels where and who might need a bit of coaching.
Voice fingerprinting. Wow. So you can really drill down.
You can. And here's a really eye-opening stat the AI reveals. Agents who consistently follow just 80% or more of these best practices.
Yeah.
They have an over 80% appointment booking rate, assuming, the practice actually has appointments available.
80% just from hitting those best practices. That's huge.
It is. It shows how AI can pinpoint these high-leverage actions, things that turn a maybe booking into an 80% success rate. This granular approach lets managers coach with real precision, boost efficiency, and ultimately it leads to a much smoother and more effective experience for you, the patient, when you call in.
That's incredibly powerful, finding those levers for such a big jump in success. But okay, we've talked about marketing wins, sales enablement, but not every patient converts, right? What about the systemic issues AI might uncover, things maybe traditional analysis would miss?
Right. And this takes us into operational insights, and it's really fascinating stuff. A huge challenge, often kind of hidden, is that over 40% of patient leads don't convert because of obstacles completely separate from marketing or the call itself.
40%, what kind of obstacles?
Things like simply no available appointment slots that work for the patient, or insurance complexities, do you take my plan? Pricing objections, or sometimes the service they need just isn't available at that location or time. Patient Prism is brilliant at identifying these exact friction points.
Okay, so it flags the operational roadblocks.
Exactly. And this gives COOs, regional managers, incredibly actionable insights. Imagine knowing you need to reallocate marketing dollars away from a service where there's no appointment capacity for weeks. Or seeing clear data that says you need to expand provider capacity in a certain area because demand is overwhelming supply. It lets them optimize insurance acceptance, pricing strategies, all based on what patients are actually saying and experiencing.
So it changes the question.
Totally. It shifts from just asking, why didn't we book that patient, to understanding if it was a marketing failure, a sales interaction failure, or actually a systemic operational failure. And the AI provides the specific answers.
And I bet for providers focused on growth, the idea of getting back leads they thought were gone, that must be incredibly appealing. How does AI make that happen?
Oh, absolutely. It's like finding lost treasure. Patient Prism's revenue recovery feature, it's a real standout. Within just 20 seconds of a call ending without booking a missed opportunity, the platform flags high-value leads.
20 seconds. That fast.
That fast. So say a patient who sounded ready to book a specific high-value procedure but didn't for some reason. The system flags it and immediately notifies the right team member to follow up. Speed is key here.
Wow. Immediate follow-up.
And the impact is remarkable. This immediate targeted follow-up leads to recovering 20–25% of those otherwise lost patients.
20 to 25% recovery.
Yes, which delivers, get this, a 15x to 45x ROI within the first 90 days. For any healthcare group focused on growth, this system is honestly a game changer. It means they're not just optimizing new patient flow, but getting maximum value from every single marketing dollar they've already spent.
That kind of ROI is hard to argue with. It really shows the power. Okay, so looking ahead then, what does this all mean for how we interact with healthcare providers down the line? Are we just going to be talking to AI bots all the time?
Yeah, good question. This brings us to what we call the automation curve. Now, AI voice agents, they're definitely popular, gaining traction. But the market isn't quite ready for 100% automation just yet. Patient Prism, for example, is currently piloting AI solutions handling about 20% of calls, mostly focusing on after-hours calls or those missed inbound calls where a human wasn't available.
Okay, so starting strategically.
Right. The future vision, maybe by 2026 or so, is for AI to manage around 40% of healthcare call volume, but specifically for the low acuity routine stuff.
Like rescheduling or asking basic questions?
Exactly. Simple appointment changes, prescription refill requests, basic info queries, tasks where speed and accuracy are key. The future is definitely going to be hybrid. AI handling the simple, repetitive tasks and live human agents for the complex, nuanced, or more empathetic conversations where that human connection is vital. And Patient Prism is building orchestrator systems that manage interactions across voice, text, chat, depending on what the patient prefers. So you can interact the way you want to, seamlessly.
That hybrid model makes a lot of sense. Play to the strengths of both. But you mentioned fragmentation earlier. All these different tech systems in a hospital or clinic not talking to each other. How does AI tackle that bigger headache?
Yeah, that's a huge issue. And one of the most powerful things AI can enable here is platform consolidation. Healthcare tech is often plagued by fragmentation, right? You've got your CRM over here, call tracking there, marketing analytics somewhere else, maybe a separate AI tool.
Create silos.
Massive inefficiency, data blind spots. Exactly. Patient Prism directly tackles this by consolidating these crucial functions into one unified platform. So it includes lead management, that marketing attribution we talked about, sales enablement coaching tools, operational optimization insights.